Well, hello, everyone. And first, let me say thank you for registering for the Celiac Society of India's International Symposium on Wheat-Related Disorders, Beyond Celiac, Beyond the Gut. And I'm Dr. Tom O'Brien, one of the co-chairmen. And with me today, it's such a great privilege to have my mentor, Dr. Jeffrey Bland. And Jeffrey is the co-founder of the Institute for Functional Medicine. This is the guy that came up with the term years and years ago about functional medicine. And our goal here today is to give you give you a big picture overview of what you can expect in our weekend symposium coming up January 12th and the 13th. So let me start by saying thank you, Dr. Bland, for being here today.
Well, thank you, Dr. O'Brien. I think this is another step that you have taken as a leader in really bringing to light extraordinarily important information that I think can reduce suffering in many, many people that don't know the things that you know and you're going to share through your audience and the other presenters. So it's a privilege to be a part of this remarkable journey that you're on. Thank you.
Thank you. Thank you so much. And for all of our registrants who are watching this welcome video, I'll start with a little background of my big picture overview of what's happened in the world of wheat-related disorders in this last 15 to 20 years. That here in the United States, there has been, as we all know, a great deal of research about celiac disease, and we have a much better understanding about mechanisms behind celiac disease. And as you may know, it is the only autoimmune disease for which we clearly know what the environmental trigger is. There's no question, it's wheat. And those people that have a genetic vulnerability with a sensitivity to wheat may manifest as a celiac patient. Now we know that about a third of the population in the Western world carries the genes for celiac disease, but only 1%, 1 to 2% of the population will get celiac disease. So even if you carry the gene, it doesn't mean that you're going to get it. And so we'll go into that in detail during the weekend as to what are the triggers that make one vulnerable to manifest the disease. But what this discussion is about, and what one of the primary emphasis of the symposium is about, is that celiac disease is one manifestation of a wheat-related disorder. And in the United States, for the last 20 years, the concept has been, if you don't have celiac disease, you don't have a problem with wheat. And now we know that that's not true. Now we know that a wheat-related disorder can manifest in many, many different ways. And I'd like to give a contextual example here, which Dr. Bland can elaborate on. It was 1984, and a microbiologist in Australia published a paper, and he said, you know, I think that sometimes ulcers may be caused by a bacterial infection. And everyone thought he was a nutcase, that wasn't possible, that everybody knows that ulcers are from too much hydrochloric acid, and that you have to give proton pump inhibitors to stop the production of hydrochloric acid. Well, what did this guy do? This guy named Marshall, Dr. Marshall, what did he do? He did an endoscopy, took a picture of the healthy pink tissue of his stomach, and then he drank a beaker of bacteria called Helicobacter pylori. He drank a beaker of this stuff, waited a few weeks until he was very sick with a lot of abdominal pain, did another endoscopy, took a picture of his ulcerated stomach. Then he took the antibiotics to kill the bacteria, waited a few weeks until he felt well again, did another endoscopy to show the pictures of his healthy pink tissue in his stomach again, and then he published it. And then everyone knew that he was a nutcase, because who's going to do that, right? But 21 years later, the guy wins the Nobel Prize in medicine. And the Nobel Committee said, and this is the quote, who with tenacity and a prepared mind challenged prevailing dogma. That's what we're doing here this weekend, is that we're going to challenge prevailing dogma as to how a wheat-related disorder might manifest for each individual. And so preparing our minds to challenge dogma, that's what this weekend is about. And Dr. Bland, can you comment on this, the concept of a paradigm shift?
Yeah, I think, Tom, this is a very, very interesting concept that you brought up, because often we, I think, believe, if we're not in the field of science, that information kind of accrues very logically over time, step at a time. Everybody kind of agrees to the next step, and then we move to the next step, and it's like a smooth curve of understanding, and there's no departures and no kind of catastrophic ahas. It's just a sense of learning as we go along the road. Yet, as you probably recognize, I know you do, but maybe many of your listeners, viewers, that a number of years ago, a science philosopher, Thomas Kuhn, wrote a book called Structure of Scientific Revolutions. That book has been now heavily socialized. Probably more people talked about it than ever read it, but the book brought up a concept that has now become the dominant thinking in how knowledge evolves in society. It's not smooth as we previously thought. It's actually moves by fits and starts. And these are what he called, and now we use this term all the time, paradigm shift, right? A paradigm shift is a breaking in the continuity of thinking, where we used to think a certain way. Everybody was in a club or a guild, or if you say something, they would associate with it because we all have the same knowledge base. Then some revolutionary person comes along. It could be as simple as an apple falling out of a tree, and someone goes Newton to try to describe why that apple would fall, and comes up with the concept of gravity. And we start talking then about certain things that at first are way ahead of what other people are thinking. And in fact, that concept is rejected very seriously. Then over time, if it's reproducible and other people can observe it, and eventually with that new perspective, that paradigm shifting perspective, individuals start saying, hey, actually, I'm observing the same thing that other person is observing. And suddenly what's called the 100th monkey, where we start getting a certain critical mass of individuals. It's not normally the majority of the population, but it's a critical mass of thinkers that start believing that because they've made a reproducible observation. And now suddenly that's what Kuhn called a paradigm shift. And then it's almost like we wake up the next day and the culture is shifted. People don't say what they believed the day before. It's now, no, I believe this all the time, right? And suddenly we have this kind of interesting memory loss about what we've been saying for years and years and years. Now suddenly we recruit to the new paradigm, the new model. And that's actually how science has evolved. That's how knowledge has evolved. It's not a smooth curve. It's a fits and starts type of situation. And in our field of healthcare now, in medicine, there are many, many paradigm shifts that are occurring simultaneously. We're actually throwing out the old rules, the rules that we learned, certainly when I went to school in the 60s in medical school education, the things that we would be tested on, the things that were considered truths. Many of those now are not just slightly changed, they were actually have been found to be wrong. And as a consequence, if I've had a joke with some of my fellow alums when I was in school in the 60s, now we're all kind of older men and women, and we've laughed saying, if we answered the questions the same way we answered those questions as students, that we got good grades and went on and got professional accreditation, we would probably get Fs today because they would be wrong answers to the same questions. Our knowledge has changed so much in these areas. So I think we're in a extraordinary time of flux with regard to what is the standard of understanding with the new science available, the new technologies, the new ways of looking at life, looking at disease, looking at health. And I think we need to be very cautious about rejecting things before we've really looked at the substance of where they've come from. Because many of the things that, as you've said, that were considered heretical to the thought of the time are now considered to be the standards of how we see things. And I think that's should open our minds to opportunity for continuous learning.
Well, that's exactly why in this conference, every registrant is going to receive access to as many of the articles that the presenters are referencing during their presentations. I'm going to accumulate all of the articles that I can get my hands on and make them available to every attendee, whether they're attending in person or in the live stream. So that you, once you've attended this weekend or viewed this weekend, you now will have access to the research so that you can download that article and read a little more. And my hope is that people come to our event skeptical. I think skepticism is an excellent place to be, but not cynical.
Yeah, very well stated. I think that's really, really important. And it's interesting for me that we're having this conversation on this day, because yesterday I received in the mail a request for writing a foreword of a new book that is actually authored by a person that is a very good friend, colleague, and co-developer with you and I over the many years in this field. And the title of the book is, and here it's a weighty book, as you can see. This is the kind of galleys of the book. The title of the book is Food-Associated Autoimmunities: When Food Turns Your Immune System Against You. And who do you think the author of this is, other than Dr. Aristo Wojani, who you and I have worked with for now, and I've been a friend with him for 40 years. He was a professor of medicine and development of really the field of immunotoxicology and new laboratory methods to assess how people respond to their environment in ways that other before him people didn't have the tools. And now we're actually seeing, and this again, just I'll show you the weightiness of this book. There's something like 1,200 references in this book that really describe how food can be a friend of one and a foe of another based upon immunological responses unique to their genes. So this concept that we might have considered when we first started down the road, you and I and Aristo, was very novel, now is being picked up by becoming the standard of identity in immunological understanding.
Yes, and it was Dr. Vojdani whose research produced the first laboratory tests looking at multiple peptides of poorly digested wheat, which we will talk about in detail during the conference about testing and what's available now, and depending on what country you're in, what tests are available to you and what the goals are for testing that you'd like to achieve. Dr. Vojdani is the pioneer, so that book is going to be a classic.
Fantastic.
Yes.
Well, it's interesting, just as an aside, to show how this body of knowledge is changing, and this is not directly related to wheat, but I think you'll see the connection to the story of evolving knowledge. About 30 years ago, I had the privilege of being in Sweden for a series of lectures. Maybe it was a little more than 30 years, about 35, I guess. And I was introduced to a woman by the name of Dr. Fira Stegshall. And Dr. Stegshall was a clinical immunologist, a scientist, had worked at Karolinska Institute, the major medical institution in Stockholm. And she had been hired by Astra, the Swedish pharmaceutical company that developed the first H2 blocking agent for suppressing acid. And it goes to your story about Barry Marshall a little bit with ulcers. And they had Tagamet, which was omeprazole, was the first drug. And it had been approved in all countries except for the United States. And of course, the United States was the biggest potential market for this drug. And the United States would not approve it, the FDA, because this particular drug had one evidence in a dog study of producing a certain kind of blood disorder in the dog. And the United States would not allow approval of the drug. So they talked to Dr. Stegshall, and they said, the sort of CEO of the company said, there's a several billion-dollar market opportunity we're going to miss here if we can't figure out a way to get around this problem, this dog toxicity. So Dr. Stegshall, using her immune knowledge, developed an immune test, a lymphocyte test using white blood cells to assess toxicity in a way that would look at immunotoxicity. And she was able to demonstrate that this drug actually was only toxic to the dog if the dog had been pre-treated with a worming drug. That was a combination of the worming drug with the Tagamet that actually induced this problem. And once they were able to sort that out and show that there was only one type of species of dog that was pre-treated with this worming drug, using her test, it allowed approval of the drug, and so the company suddenly had several $1 billion of new revenue. So they rewarded her by saying, you have a grant that we're going to give you to set up your own immune lab to develop methods that you want to do. Do whatever you want, we'll fund you. And so she put her energy into looking at the toxic effects of metals, which had previously been considered to be inert. These would be like platinum, palladium, nickel. These are metals that are used in implants and medical devices that get put in the body that had always been said to be completely inert. They didn't have a problem in the body. Using her test, however, this lymphocyte test called the ELISA test, she was able to show that actually some people uniquely were highly sensitive to part per billion levels of these minerals in their blood, and that there was toxicology that could produce arthritis, could produce neurological problems, and that over the course then of 30 years, she was able to form a new discipline in immunology called metal immunotoxicology, which is now a new field, like Aristo Rajani has worked on the development of food-derived immunotoxicology. And so the point I'm trying to bring up here is that only through the development of new sensitive ways of understanding our immune system and the uniqueness of one person in how they respond to their environment so that they can be seen as exposed to either a friend or foe, do we start to be able to piece together this puzzle that you have so beautifully been working on over the last 20 years to help understand the clinical implication of this, how you assess and then how you manage so you treat the cause and not the effect of the condition. When a person sees something that one person sees as a friend, their body's immune system sees it a foe. So it's even things as inert as metals that can produce this based on the uniqueness of a person's immune system. So I thought I'd just share that as a kind of a part of this whole evolving understanding.
Thank you for the example. It's an excellent example. We know that, and all of our attendees will be exposed to these presentations and this information in the presentations, that every human develops intestinal permeability when exposed to wheat. That happens to everyone. But Mrs. Patient, the fastest growing cells in your body are the inside lining of your intestines. Every 3 to 5 days, you have a new lining. So you have toast for breakfast, you tear the lining of your gut, but it heals. And a sandwich for lunch, you tear the lining, but it heals. Pasta for dinner, you tear the lining, but it heals. Day after week, after month, after year, until one day, you don't heal anymore. And that's when you go from a tolerance to wheat to a loss of oral tolerance to wheat. And we're going to talk about what triggers the loss of oral tolerance. So we have a concept here that everyone has a reaction, and we'll show the studies from Harvard, from Dr. Fasano and Dr. Holland and their teams, that everyone has a reaction, but most people heal from it until they don't heal anymore. And we lose oral tolerance. Can you talk for a moment about the loss of oral tolerance and what that means to us?
Yeah, I think that, again, I know you're going to have many experts that will be speaking of this topic from years of research and very precise investigations, but let me speak kind of at a high level for a second. There is a very interesting part of this story that I believe is important to keep in perspective as you start hearing the details, and that is that when we eat wheat, when we eat any food, we're eating a complex matrix of many substances. Wheat is just not one protein or one carbohydrate or one fat. It is a complex array of many, many different molecules that make up the composition of wheat. Wheat of different cultivars, different species of wheat, have different percentages of these different molecules and different types of molecules. So when we use wheat as a generic term, it's very different than individual types of wheat that are grown in individual types of soil with individual types of conditions. And And therefore, we have to really kind of move away when we're talking about how a person responds to their diet to look at what it is that they are eating that's specific to their food source and food supply. Now, the reason I think this is important as it relates to this process of tolerance is that there are other things within wheat or other grains that might be considered as adjuvants if you're a pharmacologist. An adjuvant is a word that describes something that's not the active principle, but it has an effect on activating or potentiating or altering the function of the active principle. In drugs, in pharmaceuticals, often the active principle, what you think you're taking, is activated by an adjuvant that is put into that pill or powder or whatever that formulation is that makes that drug more absorbable or makes it more active so that it potentiates its activity. And in fact, it's interesting in the regulations in the United States and FDA, you don't really have to even mention the adjuvants on your label. They can be kind of kept quiet. Another example of an adjuvant that might be familiar is the very commonly used herbicide, which is Roundup. Roundup, which has a specific chemical in it that prevents plant termination, has other active principles that are called adjuvants in it that make it different than if you just use the specific single chemical that's listed on the label of Roundup. So it's the combination of adjuvants plus the active chemical that makes the personality Roundup what it is. And people say, well, the active principle isn't carcinogenic in Roundup, but if you put all the other adjuvants in there, it actually then does test to be carcinogenic.
Yes.
So how does all this story that I'm relating relate to the tolerance to wheat? If in fact there are other things within the wheat through the processing, through the growing, through the cultivar, the species of wheat, that can influence then your immune system's response to the gluten or the other proteins in wheat, then it can start putting more and more demand on your immune system to accommodate, so that it eventually, just like a drug that may become hyperpotentized, it moves from a safe, effective into a not safe, toxic response. And so I think that as we're starting to learn more about wheat, we have to examine the full complement of all the things that have been genetically inbred and all the kinds of things that have been done in growing the wheat and how it's been processed, so that we'll really understand the complex orchestration of how that's influencing the immune system and how it may be breaking down immune tolerance. I hope that wasn't too complicated.
Fully agree. And it is why people in the United States say, well, I can eat the wheat in Europe and I don't have a problem. Whereas
Yes.
in the United States, they'll have symptoms, but if they eat the wheat in Europe, they don't have symptoms. Well, the answer to that one is that the symptoms they're referring to are gut symptoms. And we think if you don't have gut symptoms, you don't have a problem, but we know that's not true. But the gut symptoms are obvious. When you eat something, if you don't feel good afterwards, you get bloating or gas or some abdominal pain, it's pretty obvious. What you ate triggered that. And then if you go to Europe and you eat the same thing and you don't get gas and bloating and abdominal pain, you think it's okay to eat that.
Right.
But the immune response is still triggered. And if you have a genetic vulnerability to thyroid dysfunction, as an example, when you eat wheat, and many people do, you will still have that same immune response from the wheat in Europe to triggering antibodies to thyroid, but you will not have the abdominal complaints. And why is that? Because the abdominal complaints mostly come from the FODMAPs in wheat, that component, not from the glutens. That the Italians have published on this a number of times, that usually, not every time, but usually the abdominal complaints from eating wheat come from the FODMAPs in wheat and from a number of other foods. So the idea that one type of wheat is easier on the body than another is an excellent point that has to be brought up. And the whole concept of oral tolerance, and the way that I look at it, is what about the organism? What about the environment of the gut? How altered is the microbiome? And when you lose oral tolerance, what's the trigger where your immune system says, no more, I won't take this anymore? What's the
Yeah.
trigger?
Yeah.
Is it the different strain of wheat, or is it a combination of the wheat plus the immune system in the gut is already so hyperactive, trying to protect you from many other threats coming in? And so
Absolutely.
we'll talk about that in that weekend during the entire conference.
Yeah, and I think you're hitting very, very nicely on a theme that we've been working on for now, I guess it would be probably 20 years. And that is, I was introduced to a gentleman who I know you know, Dr. Patrice Connie, who is at Louvain, Catholic University of Louvain in Belgium, who had taken over the labs for a developer who had really come up with the concept symbiotics, that looking at the microbiome. And his laboratory has done some extraordinary work over the last 20 years with his colleague Nathalie Delzen, the two of them partnering to understand the role that the microbiome plays in gut integrity and immune function, and ultimately the tight junctions and leaky gut, the things that you were talking about. And one of the interesting features, there's many interesting features of their work, but one that's related specifically, I think, to what you're talking about is that the gut lining is protected by a mucin layer. It's a mucus layer that's very complex in its biochemistry, that's made by the immune cells of the gut epithelium. And it's like a lining that helps to protect from the abrasive or corrosive things that are going on in the intestinal tract. You can imagine what's going on there, as Dr. Sidney Baker used to say, you have all this vomit and crap down there. That's a lot of stuff for any cell to have to deal with. But it's protected by this lining. And there are specific types of bacteria in our microbiome that are important for regenerating that lining. One of those families of bacteria that's in our microbiome is called Akkermansia mucinophilia. And Dr. Connie has found that people that have alterations in that of their microbiome are more susceptible then to a breakdown of their gut epithelial integrity and alteration then in the passage of immune active substances into their body, creating an immune response. And so you start saying, well, what in our diet or lifestyle could influence our microbiome such that Akkermansia mucinophilia was altered in its structure and function or a number, so that you start to break down the body's normal resistance. And that comes exactly back to the points that you're making. It's a complex, orchestrated matrix of lifestyle principles, diet principles, drugs, alcohol, stress, toxic chemicals. All these things are playing roles in remodeling the microbiome that then can alter its defensive abilities to defend against the caustic nature of our gastrointestinal environment. So I think you're right on target as it relates to where this field is going.
And that's exactly the topic that Dr. Kiran Krishnan will be talking about, is about the mucin layer and the microbiome, and
Fantastic.
how they're protected or threatened by our internal environment. Dr. Bland, if you were to give a message to people who are considering attending the event or accessing the event via live stream, and which will be lifetime access so that they can watch individual talks again and again, and they're on the fence about it, what do you think the value is to bring this dream team together that you know is coming from all over the world? How might that be a benefit for the clinician and also for the general public?
Well, Tom, as you probably know, I'm not the most objective responder to that, because I have such a long history of commitment to this field, going back now, almost 4 decades. And but I believe in watching how people have responded to the understanding in this area of gut health and how it relates to our immune function, and the way that people have turned around chronic illness by employing their knowledge, either as a therapy or as a self-engaged person in understanding how they can better heal their gut and be on the path towards proper immune function. I would say that this is emerging to be a seminal portion of the new paradigm of healthcare. Everything from the crisis care medicine in the emergency room to chronic illness to wellness has a connection to this story of healthy gut immune system, and it means a healthy body. And whether it's neurological function, whether it's diabetes, whether it's obesity, whether it's arthritis, you can just go headaches, you can go down the list, skin problems. It's a laundry list of chronic complaints for which we see the pharmaceutical companies developing treatments to treat the symptoms and not treat the cause. And I think most people would like to treat the cause and not just the symptoms if they really want to turn the clock back and improve their function over the course of their decades of living. So to me, the way you orchestrated this, the type of experts that you're pulling together, the ability to really dig deep and drill deep into things that can lead to paradigm shifting ahas in a person's knowledge base, it's a prima facie requirement if you want to be up to speed with regard to either self-help or therapeutics or be at the frontier of where medicine is going. I think to not attend would be a real mistake.
Thank you so much. I fully agree, Our goal is for the individual that comes with tenacity, meaning I want to know this information. And even if it's not the primary thing they want to know, but yeah, I'm interested in learning more. You come to this event, we will prepare your mind. Our goal is to prepare your mind. And as the Nobel Prize Committee for Dr. Marshall said, who with tenacity and a prepared mind challenged prevailing dogma. So that each individual can challenge the dogma that they may have been assuming was the way to make decisions on food selections. That's new information, new concepts, with all science-based so that we all can contribute to our families, to our own well-being and that of our families.
I totally agree. And I think your advocacy in this area for the last couple of decades, Tom, has been a global frame shifter. And, I think that, again, just to give you a shout out, this is saving literally maybe millions of people from chronic complaints that they can't get on top of, and give them tools that they can employ in their own lives that are not that difficult to do once they understand what to do. So I would say right on, and thank you for all your contributions, and to all those that you've got lined up to be the key opinion leaders in this extraordinary program.
Oh, thank you, Dr. Blandon. Right back at you with the development of the concept of functional medicine and implementing it. And you now have focused so much of your attention on the individual and how the individual can apply these principles. And you founded the Personalized Lifestyle Medicine Institute, where you welcome people to come in online and just download all kinds of information. Can you tell us how people can learn more about PLMI?
Yeah, there's actually two places I think that people can on the web connect into me. One is my own website, Jeffrey Bland, JEFFREYBLAND.com. And that will get you into kind of the 40 years of work that I've been doing in this field. And the other is the Personalized Lifestyle Medicine Institute educational portal that has all these videos of our meetings and presentations. And that can be accessed through, again, www.plminstitute.org, plminstitute.org. So either place you can find me, and we're very, very pleased to have people come and look at kind of some of the things that we've done with opinion leaders who are really, as with you, changing the scope of healthcare and medicine in the 21st century.
Dr. Bland, thank you so much for taking the time today. And for all of you who are watching this, so you know, this is the godfather of functional medicine and the man who is changing tens of millions of lives. So if you have the chance, look at his information, learn more, sit at his feet online, as I have for 30 years now. And I'm very grateful. So Dr. Bland, thanks so very much for being here.
Thank you, Dr. O'Brien, very much. Be well.
Thank you.